The ideological march through the medical institutions has been rapid and unexpected. In recent years, we have seen leading paediatric specialists asserting that children who say they are in the wrong body must have their feelings immediately affirmed. We've been told that if a boy claims to be a girl or vice versa, they must be believed and fast-tracked onto a pathway to medicalisation. First puberty blockers, then cross-sex hormones, and in some cases, irreversible surgery. This is known as the gender affirmative model, and while its advocates claim that it is evidence-based, its critics say it is pure pseudoscience and that we're permitting widespread medical experiments on this generation of children. And now, messages and recorded video conferences from an internal chat system at WPATH, the World Professional Association for Transgender Health, have been leaked. WPATH is the leading authority on gender medicine in the world, with considerable influence throughout the Anglosphere and here in the UK via the NHS. These leaked materials have revealed something that many of us suspected all along, that leading medical practitioners in the field of gender paediatric healthcare are all too aware that many of these procedures are experimental, and most significantly, that they have been proceeding with irreversible surgery on patients who cannot possibly give informed consent, either because they're too young or that they suffer from some psychological disorder. The WPATH files were leaked to journalist Michael Schellenberger at the Environmental Progress think tank and have been presented and analysed in a comprehensive report by journalist Mia Hughes. It is called the WPATH Files, Pseudoscientific Surgical and Hormonal Experiments on Children, Adolescents and Vulnerable Adults. So are we dealing with the medical scandal of the century? Tonight, I'm going to be talking to a range of experts to take a deep dive into the WPATH files and explore precisely what they reveal about the ideological capture of the medical profession. Now, I should say that some of the subjects discussed in tonight's show will be very disturbing and viewer discretion is advised. So let's begin. We're going to talk to the two journalists most responsible for bringing the leaks to our attention, Michael Schellenberger and Mia Hughes. And Michael, I want to start with you. How did these leaks come about?
Sure. Well, first, thanks for having us, Andrew. Really appreciate your coverage of this. So a source or sources provided me with these internal files. As you mentioned, there's a video, and then there's also a number of written messages from a internal messaging board. And what they show is quite shocking. It's discussions of doing potential surgeries and drugs for children, including ages 10, 13, developmental delayed, people with diagnosed as schizophrenic, developmental disorders, identity disorders. We also see the people within WPATH, meaning the people inside what's called gender affirming medicine, explicitly recognizing that neither the children nor the parents understand the consequences of these procedures, which include lifelong sterilization and loss of sexual function. So this is extremely serious. This is up there with past medical scandals, and without question, in my view, I think the response to this that we've seen across the board has been real shock and horror, and that it is going to result in some kind of a reaction from governments.
Now, Mia, I want to bring you in here. It's an extremely long report that you've written, but perhaps you might want to tell us about some of the key findings.
I would say I'll give you some individual cases, but some of the key findings, the main finding for me was that you can see from these conversations that this is not a medical group. This is not a scientific group. This is a group that is engaged in political activism. So somebody will show up in the forum and they'll have a really difficult case and they're really concerned. Let's say it's the 13-year-old developmental delayed child who is on puberty blockers. And they don't know whether this child will ever reach the stage that they can consent to cross-sex hormones. And then along comes a chorus of people encouraging medicalization, encouraging the hormones, dismissing the caution, dismissing the doubts. We've got cases of teenagers with liver tumors, vaginal atrophy, uterine atrophy from the testosterone. We've got males experiencing erections that feel like broken glass. We've got very seriously mentally unwell people being discussed. And again, there's no caution. They always encourage the hormones and the surgeries.
OK, well, let's have a quick look at some of the leaked video recordings. So this one is about whether children can consent to treatment.
I think the thing you have to remember about kids is that we're often explaining these sorts of things to people who haven't even had biology in high school yet. And I know I've heard others in this kind of a setting say, well, we think adults are like really slick biologically, but in fact, lots of people have very little medical understanding of stuff like that. We just medical professionals and mental health professionals take for granted. But I don't know still what to do for the 14-year-olds. The parents have it on their minds, but the 14-year-olds, it's like talking with diabetic complications with a 14-year-old. They don't care. They're not going to die. They're going to live forever, right? So I think when we're doing informed consent, I know that that's still a big lacuna.
OK, he mentioned informed consent there. So let's consider what the parents might have to say. Let's have a look at this clip.
I try to kind of do whatever I can to help them understand best I can. But what really disturbs me is when the parents can't tell me what they need to know about a medical intervention that apparently they signed off for.
So, Michael, I want to ask you about that. One clinician there saying that, a lot of these kids, they haven't even got biology at high school level. So the clinicians are aware, as you say, that they can't get informed consent in this situation. Am I right about that?
Yeah, that's very clear from those clips that you showed, and also from the larger video. I believe it's almost an hour and a half long Zoom video, and we released it in its entirety. They know that they're not getting informed consent, so they are acknowledging that they themselves and their colleagues are in direct violation of standard medical ethics. Ethic of informed consent is right up there with do no harm. And I would just point out, it's also just such an interesting look into the power of ideology, that at no point in that conversation did they say, yeah, there's this lacuna. We can't figure out how to solve this problem. The fact that 14-year-olds don't understand what they're getting into with lifelong sterility and potential loss of sexual function. At no point do they then say, we probably really shouldn't be doing these procedures on anybody under the age of 18 or maybe 21, because the brain, as we know, is still growing after you're 18. You're still developing your forebrain. I think of how I was when I was 19 and 20. So, I just think it's such a shocking case. I think there's been a rush by some people online to sort of call these people evil and to use all sorts of names. What you're struck by is that they're so obsessed with this idea that gender is this sort of, real thing, and that it really has to be affirmed and that there's no other way to do it. It's as simple as basically saying that gender medicine is their only hammer, and that makes them see everything that comes to them as a nail to be hammered. And that includes things like, various, eating disorders, anxiety disorders, things that are clearly, There's other things going on that's quite obvious, and they're just mistreating them.
So, Mia, just finally, I want to ask you about a recent piece of investigative journalism in Quebec that showed just how dangerous WPATH's affirmative approach to gender medicine can be. Could you tell us, you know about this, you've written about this, the 14-year-old girl who was given hormones after a 17-minute appointment?
That's right. I got that wrong, actually. It turns out that she was given hormones after just 9 minutes. So it was a CBC, the French version of the CBC. They sent an actress in posing as a 14-year-old girl. She said that she had come across the idea of trans online and that she had an eating disorder. And within 9 minutes, this clinician had approved her for testosterone. Her parents weren't there. She didn't have parental consent. And when the journalist asked them about why they had done that, they said, I was just following WPATH. And in the WPATH standards of care, they pointed out you need to do a comprehensive psychosocial assessment. And the clinician said, well, I did. It's not duration. It's the quality of the assessment. So in the wrong hands, such as this clinician, WPATH standards of care and this affirmative model can mean that you end up with a 14-year-old girl getting testosterone after 9 minutes.
Well, there's a lot to think about there. Michael Schellenberger and Mia Hughes, thanks so much for joining me tonight.
Thank you, Andrew.
I'd I'd like to emphasise that the leaked recordings and messages represent the views and remarks of certain members of WPATH, but they are not speaking in the capacity as spokespeople for the organisation as a whole. And in addition, it is likely that WPATH itself would dispute the interpretation of these leaked conversations that have been made by the author of the WPATH Files and the associates. Now, we have, of course, reached out to WPATH and invited them to appear on this show, but they have declined.